I'm Dr. Wade Banner, owner of InMotion Dentists, and we practice out of Los Angeles and Orange County. InMotion Dentists is a house call dental practice where we provide house call dental services in patients' homes. We don't provide dental services out of a mobile van. We actually go into their homes where we provide their dental care. And we provide full comprehensive dental services, bedside, or we bring in a portable dental chair. So my vision for InMotion Dentists when I started was to be able to provide full comprehensive dental care for patients that couldn't get to the dental office. There's a lot of people that have certain disabilities that make it next to impossible for them to be seen. I want to be able to provide more than just extractions and dentures and cleanings. I made it a point to be able to provide root canals, crowns and bridges, Invisalign, implants even that we're starting to do today now with the help of one of our periodontists. And so our patients really appreciate and love that they're able to get all the same dental services they could in a regular dental office, but in the comfort of their home or care facility. InMotion Dentists has grown over the years. We started out with just a couple employees, but over the last 8 years, we've grown to have 15 employees now, and we're continuing to grow more every year. I started out doing house call dentistry and seeing exclusively the special needs population, those that have intellectual disability, Down syndrome, cerebral palsy, autism. And then as I started working with that population, we noticed that there was a much larger population as well that needed to be seen. And so now today we see a lot of patients that that are seniors and disabled and can't get to dental office. Maybe they have a history of a stroke, Alzheimer's, dementia, or maybe a patient has agoraphobia and they have a fear of leaving the house. And so there's a lot of people that just don't feel comfortable either going to a dental office or can't. It's physically impossible for them, or they have special intellectual disabilities that make it difficult to be seen by a traditional dental office. There are a lot of challenges working with the special needs population and the elderly disabled, as well as doing house calls. In lines of behaviors, a lot of our patients don't necessarily follow all directions that we ask them to. We might say open or bite when we're taking x-rays or if we're doing a restoration. So we use adaptive tools and techniques to be able to work with them, to be able to still accomplish all of their dental work that they need. The major benefit that I see with doing house call dentistry is that the families love us. Most of these patients have searched, and their family members have searched for a dentist to see them, and they've had a hard time finding somebody that will treat them. And then they eventually search for house call or mobile dentist, and they end up finding our practice. And it's been 5-10 years since they've seen a dentist, and they've got a lot of dental work that's needed. And so when we get done with their dental treatment, they're just immensely grateful for the work that we've been able to provide for their loved ones or themselves. So with doing house call dentistry, it's a different way of doing dentistry. And so everything has to be portable and on the move. And so we have our portable delivery system, which we use the Aseptico portable dental units. We use both the Express unit as well as the new Go unit. And we also bring out a portable x-ray unit. We bring in a laptop to be able to view those x-rays right there on the spot. And people really find that to be an interesting and cool part of the technology that when we're coming out and seeing them for their dental work. We bring everything with us to be able to provide whatever dental services need to be provided. And so at least in our van, if a filling turns into a root canal, we have the ability to be able to do that root canal right there on the spot rather than have to reschedule an appointment. So since I started my practice 8 years ago, we started out using Aseptico's Express unit, and we've recently transitioned over to their Go dental unit. And we've used them for the entire time that I've been practicing. I've used other portable unit systems as well, but I found that Aseptico's unit has been just a real workhorse and reliable for me. Using the Aseptico's portable delivery systems, we're able to provide full comprehensive services. Anything that we would be able to provide in a traditional dental practice, we're able to provide on a house call basis. So a Go system has an electric handpiece that allows you to be able to use it as a high speed as well as a slow speed system. I started using Aseptico's dental equipment actually when I was working for Western University, where I went to dental school. They brought me on as faculty, and they opened up other remote locations in elementary schools, and we used a lot of the Aseptico dental units for those. And so I had a knowledge of their systems. And so when I got out of dental school and started up my own practice doing InMotion Dentists, I decided to go straight with Aseptico for their dental unit, and I've been using it for the last 8 years now. So some of the key differences that I really like with the Go versus their Express unit, Aseptico's Express unit, is one, of course, the electric handpiece. It works perfectly. It has a little touch screen that I can wipe down very easily and adjust the handpiece speed to whatever I really want it to be. Another aspect that I really like is that when we hook up the suction units and we're not using the suction, we put them in their holders that the motor ends up turning off. And so we don't have that constant motor noise going while we're doing dental treatment. Say when I'm just placing my restoration, my direct restoration, then the motor's off and it's a quieter environment. It's not as loud in patients' homes, and our patients that have special needs tend to do better with the quieter systems that the Go provides. The size and weight of the Aseptico Go system is really convenient. It's lighter weight than the Express unit, which makes it nice for my dental assistants being able to load that in and out of the vehicle. The other thing is it's carry-on suitcase size. So if I was to do a mission trip or go out of the country or need to travel, then I'd be able to travel with it a lot easier. The Aseptico Go system is really ideal for hygienists that are doing portable dentistry. Anybody that's doing a mission trip, really any dentist that is doing portable or off-site dentistry as well. I've used Aseptico for the last 8 years, and I've used other dental systems as well. Aseptico's just been a workhorse model for me. They have very few issues with their dental units, and I'm able to provide anything that I'd be able to provide in my traditional dental practice or a traditional dental practice. I can provide it on a house call basis. And so it's just been a great dental unit and a company to work with in general. I use their portable dental chairs, their provider chairs as well, and they just have great systems.